Hi, my name is Gary Lemack, and I'm the current president of the American Board of Urology and chair of the Certifying Examination Committee. The purpose of this fireside chat is to discuss changes planned for the 2023 certifying examination. As most of you are aware, this last year we moved the certifying examination from the Grand Hyatt Hotel in Dallas to the AIM Testing Center in Raleigh, North Carolina, which is housed at the American Board of Anesthesiology. Overall, this led to a much more uniform testing experience for all involved in a much better environment. We also made some changes in the logistics such that each examinee had 2 examiners for each exam, and each examinee was permitted to exam in one single day. Another positive aspect of moving to a new site was that it allowed us to examine new testing concepts. Though our exam has frequently undergone changes over the years to improve the content, the delivery, and the objectivity of the exam, we have for many years relied on clinical protocols to cover broad aspects of our discipline. While we are confident that our exam can adequately test urological knowledge, we continue to seek improvements in our ability to assess professionalism and communication, as well as to incorporate diagnostic studies as they would actually be used in clinical practice. This year, we plan to include an objective, structured clinical examination, or OSCE, as a small part of our testing. Each candidate will continue to have 4 protocols that they've had in the past, though each protocol will be slightly shortened. Otherwise, the protocol logistics will really remain largely unchanged. Each candidate will also have 2 OSCEs. One OSCE will focus on a better assessment of communication and professionalism, as we plan to include an actor in this particular OSCE. During this short clinical scenario, the candidate will be asked to interact with that actor and will be examined by 2 examiners during that period of time. The specific scenarios are currently being developed, and we hope later in the year to give you a better idea of exactly what to expect for this particular OSCE. In addition, we also include a short OSCE for each examinee, utilizing some type of imaging in a way that we feel urologists will actually use it in their practices. In the past, we would give an image or 2 of a particular protocol, but we understand that this is really not how practitioners use diagnostic studies in their daily lives. The purpose of this OSCE will be to assess your interpretation and use of various diagnostic modalities as you would actually use it in your practice. Again, we think this will be an improvement and allow candidates to demonstrate how they use diagnostic studies in their evaluation and treatment of urologic patients rather than relying on a few selected images. While we understand that any change in the examination process can generate concern and anxiety, we'd like to reassure you that we are already examining these concepts that are going to be tested in the OSCEs. No new concepts and no new technical skills are going to be tested. We simply feel that using the OSCEs will provide a more realistic means of assessing candidates and allow our examinees to demonstrate their knowledge, their use of diagnostic tools, and their ability to communicate with patients. We do not suggest that you incorporate any changes in your preparation for the oral board examination in 2023. We feel as though that your urological training during residency will prepare you very well for the oral examination, just as it did for the qualifying examination. Should you have any questions regarding the oral board examination in 2023, please feel free to reach out to the board office or myself at any time. Thank you.